If a patient has pain in the knee, I ask him or her where the pain is located, because if the pain is located on the medial side or the inside, they tend to have either a torn medial meniscus or degenerative arthritis on the medial side of the knee. If the pain is located on the outside of the knee or the lateral side, then it's either osteoarthritis on the lateral compartment or a torn lateral meniscus. If the pain is in the front of the knee, it tends to be cartilage damage under the kneecap or chondromalacia of the patella. Sometimes pain in the back of the knee tends to be a popliteal cyst or a torn meniscus. So the location of the pain is important in helping the doctor make the diagnosis. What are the best ways to relieve knee pain before having total knee replacement surgery? When I see a patient who is elderly and has knee pain, I usually review the x-ray with them and show them that the cartilage space is narrow and they have some degenerative arthritis. And when the cartilage is thinned out or worn down, we can't really put new cartilage back onto the knee. Basically have to live with it, and the things I tell them are to adjust their activities, try to avoid running, jumping activities, lose some weight if they're overweight, take some non-steroidal anti-inflammatory pills like aspirin or Advil or Motrin, and sometimes they'll have a shot of either cortisone or a gel shot that seems to decrease the pain for 3 or 4 months in most patients.
In some patients who are either younger or older, who have arthritis isolated to one part of their knee, we can do a little less invasive surgery, which is a partial knee replacement instead of a complete knee replacement. With partial knee replacements, the knee is a little bit more natural feeling because it's less mechanical. You retain all the ligaments. The recovery is quicker. It's not everybody, and essentially we have to do a little bit more testing, such as an MRI, to make sure the cartilage is good enough to support that. It may be slightly inferior in terms of longevity, but you could probably still get about 15 years or more out of a partial knee replacement 80% of the time. For a partial knee replacement, I think less worrisome is patients' ability to regain their motion, because the fact that it's a less invasive procedure, the ability for stiffness to be a problem seems to be less chance of infection, probably a little less chance of blood clots. It's a very good operation for a select population to be quick in terms of recovery. It's not for everybody, but when the choice is made to get one, I think patient satisfaction is higher than it would be had they gone the route of a more invasive complete knee replacement. I think patients really underestimate the durability. There are people who get theirs revised in 10 to 15 years, but the survivorship for knee replacement and hip replacement is probably in the neighborhood of 90% at 15 years. That means 9 out of every 10 people who get a hip or knee replacement will probably still have theirs at 15 years from now, which is a pretty good number, I think, in terms of durability. And most people underestimate the durability of joint replacements.